today we are going to discuss about fixed dose combination of drugs. That is also called as FDCs as a short form. Now, what do you understand by fixed dose combinations or FDC? Fixed dose combination, as the name suggests, it's a combination of two or more drugs in a fixed dose ratio. So, two or more drugs in fixed dose ratio, and the formulation becomes FDC or fixed dose combinations. This is an example which has been given here. Like efavirenz is one of the drug. These are the drug efavirenz, emtricitabine, and tenofovir. So these are the drugs which is being used in HIV infections, and each of these tablets having their particular dose, and we have made a one tablet containing all three ingredients in a same dose combination. So that is called fixed dose combinations. So 3 tablet now becomes 1 tablet. So the main question is why we need to make those kind of fixed dose combinations. What are the advantages? Is it really need to make those kind of combinations? So that answer is being solved with the advantages. Now, what are the advantages of these FDCs? Obviously, these fixed dose combinations are very convenient and better patient compliance, and that is the most important advantage, right? For an example, these 3 drugs is having 3 different formulations. For an example, we already seen the examples. There are 3 different drugs, and in infections like HIV or in chronic infections like tuberculosis or hypertensive patients or diabetic patients need to take drugs for longer time. So if patient takes that many number of drug, then patient becomes quite reluctant to take a drug, and there are chances of missing the drug as well. So it becomes easier for a patient if one drug is applicable or introduced. So that is the best advantage, is better patient compliance. Patient can take the drug easily, patient can become happy as well, and there are no chances of dropping out the drug. Another advantage is certain few combinations are synergistic also, and we have already discussed about synergistic combinations in previous lectures, that some antimicrobials, for an example, sulfamethoxazole and trimethoprim, it's a very famous combinations. These are 2 antibiotics, and combining these 2 is advantageous as it's a synergistic combination, so effect increases, right? Same way levodopa and carbidopa in patients of in patients of Parkinson's disease, it becomes easier for the patient to take the medicine, and also the effectiveness of this combination medicine increases. So second advantage is the synergistic action of 2 drugs. Third advantage is therapeutic effects of 2 drugs sometimes add up. We have also seen in combined effect of drug, there are 2 ways the drug gets combined and produces its positive effect. That is, one is additive effects, where the simple A plus B is equal to effect of drug A and effect of drug B, and that is the simple addition effect. So combining some of the drugs would produces additive actions, and that is quite helpful in some chronic diseases. So third advantage is additive effect. Sometimes the side effects of one drug gets countered by other drug, and the example is thiazide diuretic and potassium sparing diuretic. These are diuretic medications used in patients of hypertensive and congestive heart failure. What happens with thiazide diuretic? Thiazide kind of diuretics, if we introduce in a patient alone, there are chances of potassium loss from the urine or from the body. So to counter that potassium loss, we are also adding potassium sparing diuretic that spares the potassium and also produces antihypertensive effects. So combination of these 2 becomes counterbalancing medications, that potassium loss caused by thiazides get countered by potassium sparing diuretics. So this kind of counterbalancing medications are very helpful. One more example is estrogen and progesterone in oral contraceptive pills. Oral contraceptive pill contains estrogen and progesterone. So the side effects of estrogen gets countered by progesterone, and side effects of progesterone gets countered by estrogen. So this is how the combination works. So the side effects get countered by another component of fixed dose combinations. And combined formulation ensures that a single drug will not be administered, and this is important in treatment of tuberculosis and HIV. These tuberculosis, HIV, and AIDS infections, the resistance takes very important step, and we'll discuss in the antimicrobial sections what is resistance. Resistance means the response of antimicrobial or antibiotic decreases, right? So it's a very major issue. So to counter that resistant thing, we need to give drugs in combinations. We need to give many drugs. Okay. So to counter that resistance, many drugs are introduced simultaneously. So at that time, we are introduced multiple drugs. This fixed dose combination becomes boon and helps the patient to counter the resistance of those antimicrobials. So these are some of the advantages of fixed dose combinations. Now, what are the disadvantages of these fixed dose combinations? So the disadvantages is, there are different, and first we can say that is from the prescriber side. Sometimes patient may not need all the drugs present in a combination. For an example, our patient needs vitamin B12 only, but we are having formulations where A to Z are vitamins are there in the combinations, and we are prescribing those A to Z vitamin containing medicine to the patient. Actually, patient is having deficiency of B12 only. So why you are prescribing other vitamins also? That increases the cost, and that might increases the chances of adverse drug reactions. So this is how the misuse of fixed dose combination is being carried out by some of the prescribers, and that is, you can say, a disadvantage, that patient needs only one drug but sometimes multiple drugs are prescribed. Dose of most of the drugs need not to be adjusted and individualized. In fixed dose combinations, the doses are fixed. For an example, a fixed dose combination contains drug A and drug B, where drug A's dose is 500 and drug B's dose is 400. Now you cannot change this dose. If you need to change a dose, you need to change the whole formulations. While, for an example, if you are only giving drug A and drug B alone simultaneously, in that case you can change either drug's dose as well, right? So if you are using combination of drug, it becomes difficult to change the dose. Then the whole formulation gets out of the equation. So that is how the single drugs are useful if you need to change the dose, especially in case of diabetes and hypertensive patients. The time course of action of components may be different. The pharmacokinetic profile, that means each drug having different pharmacokinetic profile, and in fixed dose combination, both the drugs pharmacokinetic profile should be matched. For an example, one drug's T half is 5 hours and one drug's T half is 10 hours, then it becomes difficult for that combination to work effectively. So those are the only rational combinations where all these pharmacokinetic criteria are matched. And if all those pharmacocriteria are not matched, and if you are just combining, or pharmaceutical company just combining two drugs and making a FDC, that is not the way. Then the other drug won't work. Only single drug will work. So that is the disadvantage, that sometimes the pharmaceutical companies misuses things. Pharmacokinetic profiles are not matched, and still they are making fixed dose combinations, and that is why recently around 350 or 450 fixed dose combinations were banned from India. In patients of altered renal and hepatic function, it becomes difficult for you to change the dosage, especially the fixed dose combinations. We have already discussed in fixed dose combination, it's difficult to change the doses. And if the patient is having other comorbidities like altered renal and hepatic functions, then you need to again match the pharmacokinetics accordingly, and it becomes very difficult in these fixed dose combinations to match that. So in that cases, it's difficult to use those fixed dose combinations. Sometimes with the fixed dose combinations also, the adverse drug reactions happens. Like for an example, there is a combination of A drug plus B drug, and then happens some adverse drug reactions. For an example, weight gain. Patients gets weight gain or complain of weight gain. Now, which drug has produced this weight gain? Can you tell us? No, it becomes very difficult for prescriber to judge which drug has produced a weight gain. So in fixed dose combination, if adverse drug reaction happens, it becomes very difficult to find out the causative drug. And in the last case, if one component, if for an example in a fixed dose combination, one component is contraindicated, for an example in this fixed dose combination of drug A and B, drug A is having some contraindications, depending upon the contraindications, we are using a drug in patient to patient. So for an example, drug A is contraindicated in patients, then whole fixed dose combination becomes contraindicated in that patients, right? So, and if you are using individual drugs, it becomes easy. If drug A is not useful, you can still give drug B. And if you are using fixed dose combination, then whole formulations gets out. So, contraindications to one component becomes contraindications to the whole product. So, thank you. That was all about fixed dose.